Hi everyone, and thanks very much for the opportunity to share a little bit about what's been happening in Australian Red Cross. As Katie said, we've just gone through, not just, it was an 18-month process of going through revisiting our international program and the focus of our international program. So within the Red Cross, Red Crescent world, we are one of the national societies. We work domestically, obviously, but we're also one of the national societies that partners internationally. So we support sister national societies overseas. And in the case of Australian Red Cross, we focus on the Pacific largely, and to a lesser extent, Asia. We work collaboratively with our counterparts at the IFRC, both globally and regionally, and in the country delegations. And then we've identified 9 countries where we're partnering really closely with those national societies. And one of the key things that we did when we were revisiting our program was to look at what we've been doing in the past, and we really acknowledged that whilst we've been doing and supporting very good work, we really were a mile wide and an inch deep. And so we wanted to absolutely sort of focus on particular areas of programming and really partner strategically and at depth in those areas. So we pulled out of any long-term development programming, and we're focusing from our international support. It's all around disaster risk management, and we focus on preparedness, anticipatory action, response, and early recovery, but we've pulled back from any longer term community development programming, which we had been supporting some of in the past. And the program has also moved away from what I would characterize was previously a very projectized focus to, with our 9 focus countries and then through our investments regionally and globally, we're trying to support those national societies in their own change processes. So really taking a programmatic perspective and trying to step back as much as possible and support the national societies we're working with to plot their own paths around improving their focus on disaster risk management, which is core business for national societies. So it's not imposing an area of work on national societies. It's really saying, looking at what our core business is, how can we support you as a partner to do that most effectively? We've got a huge emphasis on institutional strengthening, so recognizing that national societies are sovereign organizations in the countries where they operate. How can we support them to really be sustainable local organizations and not be dependent on donors and other members of the network, such as Australian Red Cross, because we do recognise that oftentimes we can come in with funding opportunities that we almost fall into the trap of almost like using partners as vehicles to deliver programs that we have received funding for. So we're really trying to sort of push ourselves on all of those levels. One of the elements of the institutional strengthening piece is supporting core costs. So working with national societies to understand what is it that they need to be able to survive, not to take forth massive strategic agendas, but what is it they need to fulfill their core mandate, and providing sort of untied support to those core costs. The national society then chooses how they use those. You know, largely they go to some salary costs, to the keeping the lights on, keeping the doors open expenses. And we are then sort of assessing or tracking our investments in terms of their annual reports. So we're not trying to say, where exactly did you spend every cent, every dollar? What is it, you know, you're achieving as the national society in X location? And a third area is looking at influencing and advocacy. So how can we support partner national societies and what's the stance that we can take to move the agenda around the global, the grand bargain commitments of getting behind locally led humanitarian action. One of the first things that we had to do with the new 5-year program was to establish a baseline. And given our foundational principle of locally led humanitarian action, we wanted to take an approach whereby we didn't sort of fly consultants around the world to conduct the baseline, but we supported local consultants to carry out baseline exercises in collaboration with partners in each of the 9 focus countries. So we actually hired a total of 8 teams. 1 consulting group conducted the baseline in both Indonesia and Timor. And then we had another 7 teams who worked in each of 7 other countries. I would say one of the first challenges was trying to contract local consultants. Really threw into stark relief some of the quite rigid systems and processes that we have in Australian Red Cross. So contracting local consultants and expecting them to have similar insurance levels as we would ask international consultants to have was a non-starter. So we had to go through and renegotiate clauses with our back donor and also internally get all sorts of support to change those expectations. You know, simple things like sort of the cash flow that local consultants have. You know, there were a couple of occasions where we really hadn't done enough thinking in advance of how we might manage certain aspects of consultants being able to hit the ground running. And, you know, some of the people we were working with did have access to more resources. Others, you know, we had to get sort of resources into hand before they were able to do anything. So it's kind of in retrospect, it's quite bewildering that we got ourselves into that situation. But at the time, it was we were learning as we were going, and it's certainly thrown up some internal conundrum for us, which we're now sort of looking at our contracting processes, at the expectations we have of service providers internationally, and trying to sort of put in place expectations that are commensurate with the people we're working with and what is sort of appropriate risk management. And we're quite good at sort of constantly saying others don't have as much appetite for risk as we would always like. I think this exercise also challenged us internally. Because we were trying to get sort of data that was related to an overall program, we certainly weren't looking for anything that we could sort of compare across countries. That wasn't the purpose of the exercise at all. But we wanted sort of consistent data. So we wanted to be exploring consistent issues across all 9 countries. We designed the data collection tool centrally. And there are definitely pros and cons to that approach, but that was the approach that we took. And then we shared those with the consultants in each of the locations, and they determined you know, how they would then take those forward. We developed plans of action with them, but we were very much sort of leaving it to the consultants to drive the data collection. I would say, frankly, we got back we got back data that was not consistent across all of the countries. There was definitely variations in quality. One of the biggest challenges we had was the volume of data that we received back. So despite huge sort of engagement with the teams in advance and developing outlines of the sorts of information that we really needed to see, and a lot of the information that was nice to have but not necessary, the information we got back was overwhelming, and then trying to bring that into a report has been really challenging. But you know, we've got a huge amount of rich data that I don't think we've fully drawn from yet, but we have got the starting point of establishing where we are and what we're going to look at moving forward. In terms of how we take our practice around tracking our progress forward, as part of moving away from the projectization and trying to move into more of a partnership relationship model, we're really trying to move away from, you know, sending out templates and asking partners to complete those, and trying to draw information about what's happening on the ground through conversations, through regular sort of catch-ups with our partners. They would have sometimes been face-to-face. They have not been for many months now, and so we're facing the same challenges and challenges that we're all going through for remote platforms, hours and hours of Zoom calls and Skype calls and intermittent technology and everything we face here, times multiples. But we're also looking at some of the information that Delvin was talking about, that, you know, our partners, they are absolutely prolific on social media sites. So particularly our partners in the Pacific, the Facebook posts that are up there, the WhatsApp messaging, SMS, little videos, video clips that are produced, photos that are posted. And we're really trying to track as much of what our partners are putting out in their own sort of environments that they would normally be communicating with their own constituencies, and trying to cull what gives us evidence and information to demonstrate progress in the areas where we're supporting, without making it a really sort of tightly managed monitoring process. We're also trying to flip around the process of reporting, because we have to capture information. We need to be accountable to our own stakeholders. But we're trying to, through culling all of the information through conversations and the things I've just described, actually take an approach of putting together our own narrative of how we're tracking progress in the various areas where we're working with our partners, and then sharing that with partners and getting them to basically review, correct us, tell us where we've got things wrong, fill in bits of information that are missing. You know, if events have occurred and we're looking to understand exactly who participated, sort of seek that information from them, but really get away from sending out the blank template that we ask people to fill in. It's early days. I have, you know, I'm absolutely confident that we will have successes, and there will be some major pitfalls along the way. We will sort of do point in time pieces of work, such as, you know, in-depth case studies. So we're currently looking at a piece of work around the response to TC Harold in Fiji and Vanuatu in the midst of a sort of COVID-19 environment, and how that's challenged partners and the sorts of approaches they had to take. We're again working with local consultants and sort of advising and guiding them, and then they are the people on the ground going out and consulting with multiple stakeholders. And we're also very determinedly trying to gather information from as many different sources as possible. So obviously talking to our partners, getting their perspectives on things, talking to other humanitarian stakeholders who would be working alongside our partners, and getting their perspectives on, you know, how they're seeing our partners go, because of the role that the Red Cross plays as auxiliary. Talking as much as possible to government line ministries and getting their perspectives on the role that the Red Cross is playing in different contexts, and then triangulating that with secondary data sources, as we all do.